As part of efforts to address the growing burden of injury and trauma in the country, officials of the Ministry of Health and partners on Monday converged to validate the National Injury and Trauma Plan. According to health officials, low and middle-income people are mainly affected by injuries, as they suffer disproportionately from reduced life expectancy, low quality of life, and trauma, in addition to disability and high death rates. The Minister of Health, Dr. Ahmadou Lamin Samate, described road traffic accident as the leading cause of injury in the Gambia.
If you talk about the road traffic accidents, the caliber of vehicles that ply the roads need to be looked at. Too often than not, it is the commercial vehicles, the gele-geles, that are filled to the brim, usually overloaded, and those would have been vehicles designed to actually convey goods, and they are transformed to become human carriers. Some people in some other parts of the world call moving caskets, because the structure itself, the way the seats are designed, in fact, those seats really are responsible for impairment when accidents occur.
The Managing Director, AO Alliance, Dr. Claude Martin, outlined the systems needed in facilitating and providing optimal care to injury and trauma patients.
But the rest is, which is the pre-hospital care, so the point of contact, from roadside to recovery. When you get hit, the care that you receive at a facility, not necessarily a hospital, but a facility, all the way to the neglected child of the trauma system, which is rehabilitation. Now, the new acronym that I learned over the last 2 days, last week at the WHO in Geneva, was the ecosystem. Emergency, critical, and operative care linked to the injured.
In a brief overview of the Trauma and Injury Plan, Dr. Keba Marena raised concern over the rising number of deaths and disabilities caused by injury.
What we see is that we don't have a clear trauma pathway. Capacity is limited in terms of bed space, operating capacity, and there's no sustainable implant supply currently, and the number of injuries, of course, outweighs our current capacity. As I mentioned earlier, death is not the only problem. It is what often gains the attention. But for every fatal injury, over 20 times as many are injured severely or seriously. So that's, in our context, up to between 1,000 and 2,000 per year.
The forum is expected to create a framework for developing and improving a system of networking in the healthcare sector for enhanced service delivery and improve universal access to health care, particularly injury and trauma patients. Alhaji Mbai, GRTS News.